The important thing that I want to get through to all of us today and in the next 20 to 25 minutes is that Edwards is a part of a larger community, a community in the Antelope Valley or the Aerospace Valley, the state of California, and quite frankly, the nation as a whole as we deal with the COVID-19 outbreak. I'm hoping to get through in the next 15 to 20 minutes to you the things that Edwards is doing in concert with public health best practices and following higher headquarters guidance with both within the Department of Defense and also those from the CDC. So one thing I'd like to do is solicit your inputs, questions, and potentially feedback. So you'll see the number that was on the slide, and if you could go back to that. Is that the number that you see there? If you have questions, please text those in. The number for those of you that can't see it but can hear me is 707-412-TWCC, and that's 8922. We have somebody moderating those questions, and we'll try and bin them as appropriate. Go to the next slide, please. This is the situation as it stands today, or stood earlier this morning. You can see that in the top left corner of that quad. We are in a designated pandemic. It's a national health emergency, and in fact, the president just finished another press conference today along with his team from Washington, D.C. In California specifically, Santa Clara County is in a shelter-in-place scenario, and California has just shy of 400 confirmed cases with around 12,000 people being monitored and 11 deaths recorded so far attributable to COVID-19. LA County is approaching 100 cases. There is one case that confirms to the Antelope Valley, specifically in Lancaster, and there are 3 confirmed cases in Santa Clarita, which is, as you know, just a little bit further down California 14. The LA County, Kern County schools are closed, Kern County effective tomorrow, and the Centers for Disease Control have asked us all to participate in a maximum restriction or suppression of social gatherings, be it school, work, social, or otherwise. And I'll talk why that's very important and how we can contribute to the national benefit here in just a second. Specifically, our local area has yet to be affected in any significant manner, but we don't expect that to last for the duration of this outbreak. If you look at the map of the United States on the right, you can see that by numbers, the state of California has a large number of cases. At a per capita basis, California would be probably more in line with the average in the nation, but it's still a large number of individual cases and climbing. The recommendations brought to me by Lieutenant Colonel Michelle Westy, who's our public health officer for Edwards this morning, were to elevate to HBCon Bravo, which I concurred with her recommendation and approved the elevation of HBCon Bravo this morning, to reemphasize that we do transparent, aggressive information flow. In fact, our Secretary of the Air Force, Secretary Barrett, encouraged us to over-communicate on this topic. I'm doing this, I had already planned to do this before the Secretary asked us to over-communicate, but this is an example of that, and you can expect your squadron commanders and directors to be in constant and very high bandwidth communications with you as we progress into and through this storm known as COVID-19. The message of what you can do from a public health perspective remains pretty clear. It's a pretty simple process. It's one that we have all been taught for much of our lives, and that is simply wash your hands. This is a great time for you to talk to your friends, neighbors, your children, anybody else you come in contact with on proper hand washing. I'm not going to give you academics on that, but this is a really important time to re-emphasize or retrench hand washing and how important it is. When hand washing is not available, a sanitizer that has at least 60% alcohol in it is an okay interim step until you can get to a place where you can wash your hands. The second step, other than hand washing and hand care, is cover your cough. Coughing into your elbow or coughing into something that's a disposable item is very appropriate. And then, when you can, wash your hands after you have that large blast from your mouth or your nose. The third one is minimize interpersonal contact. And the fourth one is stay home when you're sick. Stay home if you feel sick. And there's some specific guidance on what COVID-19 symptoms appear to look like, and more importantly, what they're not. If you have any questions on those or nuances there's information on the CDC site, and there's information through the public health officer here at Edwards. In addition to that, we are decreasing non-mission essential functions. We're trying to maximize, in a very aggressive fashion, telework, or those that can work from afar. We've also instituted teaming. You can see there in the bottom part of the slide on the right bottom side, we've encouraged what we're calling blue and silver teams. And so if you are in an office environment or a work environment that is compatible with teaming, you'll be divided into, or have already been divided into, a blue team and a silver team. And our intent there is to keep the mission moving. What Edwards does to contribute to the national defense of the nation will not stop, and our importance will not go down during this crisis. And therefore, teaming is a way to keep the mission going, albeit at a lower level. There'll be specifics available from your group commander, director, and others down your chain of command on just how you can divide into that. As an example, there's a shop that works for me directly. It has 2 people in it. They both have laptops, and they both perform very similar functions. I've asked those 2 individuals to go into Team Blue and Team Silver and never physically be in the same place unless they have to be, but they can virtually still be a team and virtually still get much accomplished. They're going to publish their schedule and encourage a lot of virtual meetings and virtual work as well. In addition to that, and other examples of social distancing, the CDC guidance was 50 as of yesterday, and then presidential guidance on yesterday said try to limit that down to 10. There's good cause to be cautious about how many people you affiliate with and associate with, and more importantly, the social distancing that you have with them while you're in the room with them or while you have to be with them. That would include at home. It would include office environments where you have no choice but to be in the office environment. And as an example of this social distancing, you can see that myself and both Lieutenant Colonel Michelle Wesley and Miss Michelle Lovato are all exhibiting examples of the minimum social distancing requirements. It's not the time to shake hands or give high fives. If you have to, an elbow bump or some type of a foot tap, very appropriate, and I appreciate those as well. The last thing I want to draw your attention to on this chart is the bottom left corner. If you look at the shape of the curve of the number of cases in the United States, that curve is not quite going asymptotic or vertical, but it's a slope that we don't like, and it's something that has my attention. It certainly has the Department of Defense attention, and it absolutely has the attention of our command and our national command authorities. Our objective is to make sure that we flatten that curve just as soon as we can, and we do our part. And on the next chart we talk about, I'll talk about that a little bit more in detail. But before I do, Colonel Westy, anything else you want to correct me on or clarify on the quad chart before we leave it? Okay, terrific. Please go to the next chart. This is our charge. As a nation, we need a lot of people that are not sick and that probably will never be sick to help us flatten the curve. And the whys are really, really paramount, and they're literally a matter of life and death. If you look at the shape of the curve of cases in the United States right now, we don't know if that curve is going to end up looking like the red curve or the blue curve on this chart, and we want it to look a lot more like the blue curve than the red curve. And the whys matter. The why is that we don't want to overwhelm our healthcare system. Other countries that have experienced this in the very recent past, their curve shape has looked a lot more red than blue on this chart, and we want to do our part. We're going to do our part to help the United States, especially the continental United States, look a lot more flat than a spiky curve for the number of cases of COVID-19. There's a lot of words on this chart. I'm not going to read them to you, but that's my primary message to you. The reason that Edwards is participating in this is not because we're told to do so. Of course, we're going to follow orders and we're going to do what our authorities ask us to do or direct us to do. But it's because we're good neighbors, we're good citizens, and we're good people. And one of the things that we can do to help in this national crisis is to do what we can to social distance, to do better hand hygiene, to follow the basics of covering your cough and preventing the spread that way to help ensure that we flatten the curve in the local area and on base. So with that, I'd like to go to your questions, and hopefully we'll have some answers for you. While we're calling up those questions and I'm getting the first ones queued up, I encourage you to look through the information available at www.airforce.mil. There's a COVID-19 link there, and there's some large, I'll call posters type information there, but 15 days to slow the spread, do your part to slow the spread of coronavirus, and other large things like that. I implore you to go to those sites or sites like it. The CDC is also another great location. Consume the information and then distribute it. Talk about it at work, talk about it at home, talk about it during your commute. And that's a way that you can help information curb the spread and the peak of that curve as well. All right. Anything else you want to add on that?
No, sir.
Colonel Westy, go ahead.
Just, again, practice good hand hygiene. That's probably the most important thing. And be aware of trying to practice that social distancing. And if you're sick, stay home.
All right. Basics. Wash
The
your
basics.
hands, cover your cough, social distancing, and stay home when you're sick. All right. Chief, I'm ready.
Yes, sir. First question, people were asking, is the CDC and the school age annex going to stay open?
So the CDC, the Child Development Center on base, and the school age annex on base were already operating before this crisis hit at approximately their capacity. So any additional capacity that will be available there will be as parents decide to not have their kids in the CDC. Examples of that would drive them to that would be parents that are on the blue-silver teaming and they don't have another reason to be here. They would probably, I expect them to temporarily remove their children from CDC while they're not required to be at work in a blue-silver teaming arrangement. It's going to be very specific to the family, however, on what they can do and how they can do it. And I fully recognize that a lot of families that have children in the CDC also have children at school, and that may also drive some family dynamics that either increase or decrease the demand signal at the CDC. However, the question was, are they going to remain open? I don't know, is the frank, honest question. What I'm going to receive are advice and counsel from public health officers like Lieutenant Colonel Westy here, and the conditions inside and outside the gate, and we'll decide out of an overabundance of caution when having the CDC in session is no longer appropriate. Right now, it still is, and right now we expect to operate at close to normal times, and probably, although I can't guarantee it, close to normal capacity for at least the next few days, if not the next week to 10 days. The school age annex, probably a different animal. The school age annex is going to be large demand starting tomorrow when the schools on base are no longer available. They will also have to deal with the number of people in the same place at the same time, and how we're going to specifically handle that at the school age annex will probably mean a very limited number of folks there or the outright shutting down at a future date, and I have not decided what that is. Another thing that's important for me to communicate to those of you with kids that could attend the school age annex or the CDC is that if we're forced to make a decision on which one of those two facilities to leave open, I've let both the MSG and the FSS team know here that the right answer is to leave the CDC open and move providers from the school age annex to the CDC when and if those conditions drive us to make those decisions. Again, I hope to not have to do those, but that's how I expect to act when conditions warrant. How many days or hours away is that will really be determined by how the conditions grow and progress in the valley and on the base. And I want to go back to and you have a big part to play in that. You have a big part to play in that in your personal hygiene, and also making sure that your kids, children, family members also do the same thing, so we can flatten that curve and keep a minimum number of people from being infected at the same time. What's the next one, Chief?
Yes, sir. Next question is in regards to the gates. People are wondering, are we going to close down any of our 3 gates?
Right now, I don't have any plan, and I could probably come up with some scenarios where I would consider closing gates, but I don't have any plan to restrict access at the gates. There are scenarios that would cause us to degrade that, but none are in play right now, and I don't have anything that leads me to believe I'll restrict access to the base, as long as we stay in HP condition, HP Con Bravo, and that will be determined by the situation in the local area and on base as well.
Okay, next question, sir, but I think it's going to be for a few of you. It says, given the recommendations of self-isolation and social distancing, is there a reason why the base hasn't gone to telework for all possible civilian employees and instituted mandatory social distancing?
Okay. What I'll do here is I want to break that question up into 3 parts. So I'm going to talk at the command level, and then I'm going to hand off to Michelle Lovato, our CPO, and talk about what does it take to actually be a teleworker, and then what are we doing as an interim step to get there rapidly for those of you that aren't there yet. And then after that, I want to talk to I'd like Lieutenant Colonel Westy to talk about social distancing has to happen at home too when you're teleworking, not just at work. So first, my part. About 10 days ago, guidance that was disseminated through the group commanders and directors was to prepare for and start to plan for and implement where appropriate maximum telework. I recognize fully that that isn't necessarily a fast process. So at the same time we emphasize start maximum preparations for telework, I also ask for additional authorities or additional capability to rapidly get people to telework eligibility. I think those authorities are imminent. They're not yet final. However, other things have rolled down that impact different types of leave, et cetera, and I suspect that's going to be a question some of you are going to have as well. But first, let me ask our CPO, Michelle Lovato, to talk through the telework options that we have available right now.
Yes, sir. Good morning. In regards to telework and being telework ready across the wing, the policy is AFI 36816 for your future reference. Steps are being taken to maximize telework. If you're currently telework ready, you and your supervisor can implement as necessary. If there are steps to research whether you can be telework ready, there's training. It's all covered in the AFI. We understand that this posture takes other considerations given the schools are closing. If you are able to telework, your supervisor will sit down with you and determine what tasks you may do and perform from home. On 8 March, the Air Force modified the policy for telework in that you can telework while caring for a dependent or a child at home, but you must account for work and non-work hours. Again, measures are being taken to move forward with that. Across the Air Force, there's the other aspect, sir, is IT readiness. So we know this will maximize the IT infrastructure, so steps are being taken to expand and look at possibilities to accommodate more. Again, get with your supervisor, but I'd like to share the phone number at civilian personnel for supervisors and employees if you have questions about telework agreements, how telework works. The number at customer service is DSN 527-3840. Just ask to speak to an employee relations specialist. And you will see more that comes through the command chain regarding telework and telework readiness. Again, I would just like to emphasize, we know that not every position is telework eligible or you can perform work at home. We do understand that. So as the mission changes daily, we will guide and advise your commanders and supervisors on how to report and where to report. And considering the blue and silver teams, we will be involved with that regarding your civilian personnel workforce. Again, our phone number at civilian personnel is 277-3840. We will field any questions you have during this time, during COVID-19, to help you and your supervisors and commanders.
Right. Thanks, Michelle.
Yes, sir.
And Lieutenant West, anything? So social distancing, we talk a lot about in number of groups. Right now we're exhibiting minimum social distancing right here in the room. But any thoughts on that, especially as it relates to telework?
Yes, sir. So it is, the social distancing is really what they were recommending is 3 to 6 feet of distancing from someone else. But it also means that it's not, if you're working, you want to work from home, you don't want to go out to public places if you can't maintain that social distancing. So that's really the most important part. Going to the grocery store, going to get your basic needs, is something that can be done. But just when you're out there, just try to maintain that 3 to 6 feet social distancing from other people.
Absolutely. So one of the things that I noticed from a social distancing perspective, I noticed over the weekend some children actually carrying around little pockets of hand sanitizer. An example of something when they're out in public they had on them, and I thought that was a very appropriate thing given these times. And they were all in the 7, 8, 9-year-old range anyway, so extra hand sanitizer wouldn't be a bad thing. Let me loop back to teleworking in general, and Ms. Lovato said it already. I fully recognize that not every job we have is going to be compatible with telework. For those of you that aren't compatible with telework and we still decide to go into blue silver in your work unit or for your capability, that's a little bit more complicated but very solvable problem. We just need a few more days to precisely figure that out. Information on how we break into blue silver teams, if we can, at your work unit will be disseminated through your chain of command. And your chain of command will be in high bandwidth contact with both the military folks and military advisors and also civilian personnel. I think it's another important thing to emphasize that if you're blue-silver teaming, I gave you an example earlier in this broadcast of I have a shop of 2 people. They're blue-silver teaming, but the member of that team that's not physically at work will still be working, they'll just be teleworking, and then they'll alternate days or some other type of an alternating or revolving schedule. And so that's a hybrid solution between blue silver teaming and telework that I think is also well within your discretion as commanders, supervisors, and directors, informed by the requests and the good ideas and, quite frankly, the innovative ideas of the people that work for you and are still trying to get the mission here at Edwards done. All right, Chief, next question.
Next question. So, is it safe for civilians with compromised immune systems to be going to work?
Go ahead.
Yeah, sir. So at this point, I would say it would be advisable for them to talk to their doctors about that and bring that to their supervisors. The messaging is that elderly, especially those 65 and older, anybody that has an immunocompromised condition such as a heart condition, a lung condition, it would be advised that they try to telework if they can.
So the answer to the question is yes, in a word. But I think anybody that asked that question is looking for a much more nuanced response. Lieutenant Colonel Wesley just talked about that, and the bottom line is that that's a confluence of a lot of issues. The civilian member, because that was the specific question, needs to be able and willing to trust their supervisors with their PHI, right? So they need to be willing to share and understand or explain how telecommuting would be better for them and better for the mission. If there's a better teaming arrangement that they can do, we fully support that as well. But right now, it is not. We're not directing people to not be at Edwards based on their pre-existing medical conditions. But if you have something that's specific or unique to you or your family, you need to talk to your medical providers and or public health on the best course of action for you so that we can continue to flatten the curve.
Okay.
All right, next question.
Next question, sir. Are we going to close any of the customer service facilities on the base?
So that's a generic question. I'll try to go through them in some specificity. As many of you noticed, we've already throttled back a couple of places. I'll give you an example. In coordination with our partners at the exchange, facilities that have both a drive-through and a walk-in service have gone to drive-through only to minimize exposure or commingling of the population. There is a facility on the base that you'll note has gone to that. In addition to that, to minimize both the commingling risk and also to minimize the cleaning requirements and allow folks to dedicate their cleaning activities to things that we can't avoid, the ability to sit down in open air areas and restaurants on the base have been restricted or removed altogether. And so those are the types of services that we're following the national lead and national guidelines on. And if you have been in any of those food service areas, you've seen that as appropriate. Other customer service functions, we've talked a little bit about CDC and Child and Youth Services already. I don't anticipate any additional changes specifically to CDC and Child and Youth Services that we haven't talked about. Places like MPF are currently operating at their normal hours and normal capacity. However, please remember that personal hygiene and social distancing will be very appropriate there. But I don't have any foreseeable I don't have any plans right now to close MPF. Another customer service organization is the medical group. Right now at HBCon Bravo, they've gone to a single point of entry. There will be other restrictions because they're doing multiple roles, their normal health provider roles, and they're also helping us navigate as an installation and as a community through this crisis. One of the items there that is always of our attention and our awareness is the pharmacy. Right now, the pharmacy hours have not changed, and as changes are warranted based on the conditions locally, we'll advertise that through mediums like public affairs, and we'll obviously have postings preferably at the gates, but certainly on the facilities themselves. And if there are any other specific customer service items or locations that you would like to know more about and its hours, please text that in, and we'll try to post it in a publicly available site. Chief, anything else on that one, or next question?
Nope. Next question for you, sir. Can you explain the decision to close down the gym to active duty only personnel?
I can. If you can go back to the slide with the curves, please. The blue and the yellow curve. The slide right there in the top right corner of that curve is quite frankly and very definitively the reason that we decided to close the gym to all non-active duty folks. Any place that people are going to have surface contacts where they share, so for example, gym equipment, is a place where you could potentially have transmission. And the fewer people you have in a facility like that, the better you'll be able to limit the transmission, or at least the rate at which it's transmitted. So literally flattening the curve is the reason that I decided to close the gym to all non-active duty members. Now, if the gym is a risk point for transmission, why don't you close it outright? The answer to that question is we're balancing flattening the curve with our wartime requirements and our ability to be able to have fit to fight and deployable airmen. And that's why we left it open to active duty only. My request, and frankly, my plan personally, is to spend a lot more of my exercise time by myself, exhibiting awesome social distancing outside, and the weather is probably going to cooperate. And many of you that are up in the higher elevations today will be able to do that outside with a nice snowfall in the background. So I want to make sure you hear me loud and clear. This wasn't a anti any part of the crowd. It was preserving wartime capability in the active duty force while taking a logical step to reduce opportunities for transmission. And then please continue to do what you can where you can, respecting social distance to stay fit to fight, whether you're an active duty member or a civilian.
Can I add something to that, sir?
Absolutely,
So
Chief.
with all the services on base, there's the easiest way is to just shut them all down immediately because of the threat. At the same time, they do provide a service, and some of those services are very necessary to the base. And so I think that there's going to be lots of stair-step approaches that the wing will have to take in order to try to keep as much of the service open while still maintaining or limiting the risk. But at some point, all of those services could go down just because the risk is too high and no longer outweighs the goodness that comes from using it. So this is something that I think the wing talks about a lot, and we're really trying to keep everything open as much as possible. Moving to go for certain types of food, we still allow the food to happen. You just can't hang out there, and that will limit that risk, would still allow that service. And so all of those, you've not taken any of those lightly, and it's a lot of discussion that goes into that process.
Chief, what I'd like to do is, I think we have time for about 2 more questions, and if they're short, maybe 3. So go ahead and triage the
Yes,
the
sir.
next
I've got
couple.
one main one that's very specific. I think it's for you, ma'am. People are asking about NAF Flex employees, if we end up having to close down any of these facilities.
Yes, so if the base installation commander, Colonel Heiger, shuts down the base, the NAF employees would be administrative leave would be available to them, similarly for the civilian employees. So it's very much dependent upon whether the facility is open or closed, but yes, the NAF employees are covered by the COVID-19 guidance. Sir, can I add one thing about telework?
Absolutely.
I failed to mention that telework is voluntary. So telework arrangements are voluntary. The employee must agree to telework. In a only very rare situation, mission essential, can a supervisor direct an employee to telework. So I just wanted to add that one point, that as we move down the steps of telework and offering that as a mitigation option, that it has to be voluntary.
Got it. Chief, let me add one more thing on top
Yes,
of
sir.
that. One of the large questions that, so last week I was at Wright-Patterson Air Force Base as part of an Air Force Materiel Command Senior Leader Conference. One of the very meaty, detailed discussions we had was what type of guidance and what type of OPM clarity can we get out of status of a civilian, depending on whether they were symptomatic, asymptomatic, quarantine, not quarantine, social distancing, teaming, those types of things. Your command team, up to and including General Bunch, is very aware, keenly aware of the demand for guidance. Right now, the best information that I have available, with more to follow, is that if you are being quarantined for protection of the general public, but you are asymptomatic, that will be a different leave category known as safety or weather leave. If you are placed in or not able to work, we're probably going to end up in an admin leave, but those specifics will be very tailored to your work center, and you'll need to work very closely with your supervisor and your commander director for approval to get that administrative leave. The authority to grant administrative leave remains with the Title V authority, which for everyone at Edwards Air Force Base, including mission partner units, remains with the installation commander. And so we're looking at how can we rapidly get to those approvals, but we're waiting for a little bit more higher headquarters guidance before we know exactly how to roll that out. But that was keenly addressed, specifically addressed, and I think we're tracking to goodness. I expect that is going to have worked itself out by the end of this week and realistically no later than early next week. All right, Chief.
Sir, most of the questions are coming in are all revolving around things that you've already mentioned. There's a few people that I don't think were able to watch the video cast, and so I think we'll end up getting that released and placed somewhere for everybody to actually watch it. But I think the main thing is, what leadership guidance do you have for the rest of the base and our staff sergeant level, our CGOs, as we go through this the next couple weeks?
Absolutely. So let me go back to a couple key points. The first one is that Edwards Air Force Base does its wartime mission every single day. A public health emergency, a public health crisis, COVID-19 in specific, does not reduce or rescind our ability it reduces our ability, but it doesn't reduce the demand signal for what we do to contribute to our nation's defense every day. My guidance to you as supervisors, directors, commanders, chiefs, first sergeants, is to think about this as a steady state. We're going to get through this initial bow wave and the transition or adjustment. But the curves that we saw and we talked about earlier today, if the curve is flat, the steady state may not be back to zero. The steady state may actually be at a residual number. Epidemiologists argue or debate on what that could be or what it looks like. But this is potentially going to be a long duration state that we're in. You heard the president say, and if you look up his words from yesterday, that this is potentially going to take us well into the summer. With that in mind, also knowing that what we do every day for the warfighter is very important and won't go away, my words of encouragement, my direction very broadly, are find ways, innovative ways, that you can continue to get your mission done so that we can deliver capabilities for the warfighter. It will not be at the 100% rate that it was on the turn of the year this year before COVID-19 became a world issue, but it will certainly be much, much above zero, and I know you're up to the task. I look forward to helping along that way, but get out ahead of me. Go. Continue to generate mission that you think is appropriate, balancing what we owe the warfighter and what we have to do to protect the public health and flatten the curve for the nation, for those of us that are unfortunate enough to be infected by the COVID-19 disease. All right. With that, I thank you for your time and attention. Go outside, look at the gorgeous weather, enjoy the sunshine. This is a great place to be. This is a great place to work. And one of the things that's awesome about being here is that the innovative spirit and the let's get it done nature of our team and our community is going to power us through this much better than a lot of other places would have been otherwise or without that innovative spirit. So I commend you in advance for the work that you're going to do. I thank you at the bottom of my heart for what you've done for us in the past, and know that if there's something that you need or that I can move out of your way, please ask and funnel it up, and I'll do everything I can to enable and empower your help to our mission success. Until next time, so long from the center of the aerospace testing universe.